के दिन में अगर किसी को पाइल्स और हेमोरॉइड्स के सिम्टम्स हैं तो मैक्सिमम ऑफ देम विल search in Google and type how to get rid of hemorrhoids without surgery, and whatever advice is displayed people will follow. होता क्या है उसके बाद? Like hardly 10% of the people will get cured, but what about the remaining 90%? Well, with the remaining 90%, the symptoms are either persistent or the severity of symptoms has increased, which is very, very sad. In India, hemorrhoids or piles is considered a social taboo, because of which people are not open to discuss this issue with their friends or relatives, and because of which many myths are prevalent among the common people regarding the cause and treatment of hemorrhoids. So today's video is an attempt to demystify the prevailing myths regarding hemorrhoids with the help of scientific basis. To demystify this myth, first let us understand the types of hemorrhoids. Hemorrhoids are of two types: internal hemorrhoids and external hemorrhoids. Internal hemorrhoids are located inside the rectum above the dentate line. In fact, everyone has internal hemorrhoids, but it is not a problem until and unless the veins inside it become swollen, engorged, or the tissues of the hemorrhoids becomes lax. You cannot feel or see the internal hemorrhoids, and it rarely causes any pain or discomfort. However, due to straining or irritation during bowel movement or during motion, you might notice bright red color in the toilet or in the tissue paper. External hemorrhoids are located inside the skin around the anal region. It presents as a swelling around the anal region, and it can be associated, or it is usually associated with pain or discomfort or itching, or might be bleeding also. However, you must also know that majority of the patients suffering from piles, in fact more than 90% of the patients have internal hemorrhoids. ऐसा कुछ नहीं है. There is nowhere mention in the medical literature which says that spicy foods are the risk factor or cause of hemorrhoids. However, if you are suffering from piles, there are certain foods which you must avoid. These foods are those which are very less in dietary fibers, such as meat products, specifically the red meat products, processed or junk foods which are very rich in cheese, or maida or the refined flour. What happens? See, क्या होता है कि if your dietary intake of fiber is very less, it causes hard stool or constipation, and because of which you are forced to strain during the motion. And remember always, straining is one of the most important risk factor for hemorrhoids. With the recent scientific advances, piles can be easily and effectively treated through various treatment methods which are available nowadays. For grade 1 and some of the grade 2 hemorrhoids, your dietary and lifestyle modification can cure majority of those grade 1 and grade 2 hemorrhoids. However, if the symptoms are persistent, certain office-based treatments are available, such as foam sclerotherapy and rubber band ligation. The most significant advantage of these office-based interventions are that patient can be discharged post the procedure within an hour or two, and there is very minimal or in fact no pain. Laser hemorrhoidoplasty is an advanced procedure for grade 3 and grade 4 hemorrhoids, which offers the advantage of minimal post-operative pain, minimal bleeding, faster recovery compared to the conventional surgery. Hemorrhoids can never cause cancer. But one important thing which you should always remember is that the presentation of certain colorectal cancers and hemorrhoids can be very similar. They present as bleeding per rectum. So friends, if you are having symptoms of bleeding per rectum, please don't ignore it thinking it to be piles. Kindly visit a proctologist or a surgeon. Most of the exercises are good at preventing hemorrhoids, with one possible exception of weightlifting with poor technique. Weightlifting with poor techniques increases the pressure of the veins in your hemorrhoids, thereby precipitating the risk of bleeding. If you are having hemorrhoids, mild to moderate exercise such as yoga, swimming, jogging, or in fact just a morning walk can help in healing your early hemorrhoids. How does regular exercise helps in preventing or healing your early hemorrhoids? Well, if you exercise regularly, your colon or your bowel movement will be regular, and if your bowel movements are regular, you are not required to strain during motion. And remember always, straining is one of the most significant risk factor for hemorrhoids.